So, I just left off at finishing my second check, as well as rechecking my calculations. So I know that they are good. And oh yeah, we missed that 1 minute or something, right? Okay, so for my diluent, I chose 100 milliliters of normal saline. Here it states that we can dilute it another 50 to 100 milliliters normal saline or D5W, administer over 15 to 30 minutes. I chose the 100 since this is the first time that the patient has ever gotten this drug, so we want to dilute it as much as possible to prevent irritation or whatever. Administer over 30 minutes is what I'm going to choose. Again, also to give him a longer time to get used to it. And I'll be watching him for 5 to 10 minutes after I start infusing it. Okay, so I'm going to swab my port for 30 seconds, let it dry for 15. So I kind of let that one fall. I'm just going to swab again, let it dry for 15, then insert my 2.5 milliliters of medication. Okay, so that's good. Now we are ready to go see the patient. Right, we have a med label here that I've prepared as well. So it has the dose 2.5 milliliters, total volume of 102.5 with the normal saline. We're going to program it as 205 milliliters per hour in the pump. Okay, so we're going to take our MAR, PDM, our tubing, see the patient. Okay, so knock knock. Introduce myself, state my name and designation. Here to give the 11 o'clock medication. Can I get you to state your full name, please? Vagus Vault, Vagus Vault, Vagus Vault. Okay, date of birth, 31 October 1990, 31 October 1990. Okay, and that's what he said as well. And then allergies, walnuts, walnuts, walnuts. Okay, good. Did you say it's 10? What time is it?
Yeah, you're almost at 3 minutes right now.
Okay, so, right, I just verified him. So now I'm going to take my medication. So entering the room, I would have done a safety check, make sure that he's okay, nothing on the floor, etc. Bed is at a low level, so I'm checking the label here with his wristband. It matches. This is the right medication for this patient. So I'm just going to educate him now. Have you ever taken penicillin G sodium? No? Okay. This is a new drug the physician has prescribed for you. It is for the cellulitis, aka the infection in your arm. It's going to make you feel better. So you can possibly expect rash, coma, seizure, anaphylaxis. I will be watching you for all of those things. Please let me know if you start feeling funny or at all like that. Great, and at this time you can refuse if you'd like, and he's not refusing, so great. We're just going to do our third check now. So with our label and our MAR. Okay, so Vagus Vault, right drug, penicillin G sodium, penicillin G sodium, right dose, 2.5 million units, 2.5 million units. Right route is IV, and the right time is now, every 6 hours. So I've educated him, done my third check. Okay, we're going to assess his IV now. Okay, so this is looking good right now. There's no...
5 minutes.
Okay. This window should be clear. So we don't see any drainage. There's no redness. It doesn't look swollen. It looks okay. Do you have any discomfort or pain? He's going to say no. How about when I palpate? And he's going to say no, it's okay. And the skin is not too hot, not too cool, so it's a normal temperature, no swelling. This is good. We're going to follow the line here. This is unclamped, and we see that our IV primary rate is at 25 milliliters an hour, so that matches our MAR. It's actually only stated in the physician's orders, but we'll say that it is on the MAR too, so that's right. Okay, so now it's time to do the actual thing. Okay. I also have my tubing label that I'll do. Okay, so this is intact. It hasn't been opened. All of our components are in here, so I've checked that before.
You're at 6 minutes.
6 minutes? Okay. So first we will lower our primary. We're going to make sure that our clamp is closed. We're going to spike our bag, maintaining sterility. Okay, and it's clamped. Okay, and we're going to choose the port closest to us because we want the machine to manipulate the rate and know when the secondary has stopped infusing to kick the primary in again. So maintaining sterility, I just swabbed my port. It is sterile, sterile to sterile to sterile. Okay.
7 minutes.
How many?
7 minutes.
Okay. So we should be getting air bubbles. Okay, and we clamp it again. And it's higher than the primary. Now we're going to go secondary, and our label would be stuck here. So we're going to say milliliters per hour, 205, and our total is 102.3. No, 103. Okay. Confirm secondary. Press to begin. Okay, so it's starting now. We've unclamped it. We're making sure all the lines are unclamped. That's part of our exit check. I'm going to let him know that I'm coming back in half an hour. I'll sit here and watch him for 5 to 10 minutes to see that he's okay. Come back in half an hour to flush the line, see that the primary is kicking in. I'm going to document on my MAR with my initials and designation and sign the MAR, and that's how I'll document. Perform the safety check, and that's it.